So, Professor Bontle Mbongwe, welcome to the World Conference, to Dublin, and thank you for agreeing to make time to speak with Ash Scotland. How are you finding the conference so far?
Well, I find the conference very exciting because when you're a public health advocate, there's so much that goes on, whether it's about children and the impact that tobacco is having on children, the influence of the tobacco industry on children, and the moving away of the normal ordinary cigarette, which was earlier on promoted by the tobacco industry, and now a shift to these new products called vapes.
Absolutely.
Yeah.
And tell me more about your own work and your country in Botswana.
Yes, Botswana is, a country with a population of about 3 million people, but the size of France. Mostly we are a desert country, and we are a middle-income country, and a lot has happened in Botswana. Okay, first, the good thing is that way back when the WHO started the World No Tobacco Day, I think it was in 87 or so, we were amongst those who were celebrating the World No Tobacco Day, being the theme then was tobacco or health, choose health. You know that this conference has actually evolved from being called tobacco or health. Now, for the first time, it's called a Tobacco Control Conference. So that came from this tobacco or health theme. That's my thinking. And so from then on, there was a lot of awareness from the World No Tobacco Day about the harms that are caused by tobacco. And so in 1992, then the government of Botswana was among the first to adopt a law that was called the Control of Smoking Act. And the Control of Smoking Act, of course, back then, let me tell you something that is, how things have changed. Back then, it was talking about protection of tobacco smoke. But you know what happened? If you are in a conference room, and then the law would allow that, if you are sitting that side of the conference room, you could smoke. If you are sitting this side of the conference, you could not smoke. Same in the airlines. But then when the FCTC negotiations started, then it became out all clear that we've been killing people because one person who smokes in a room is going to affect other people. And so then in 2004, then the government amended the law now to ban smoking in public places. Well, it was a partial ban because then it was like create places for those who smoke, a room for smokers, and if you are a restaurant, then you cannot be smoking in the same room. Maybe create another place where people can smoke. So there were those little changes. And then as we moved on, then in 2005, the government ratified the Framework Convention on Tobacco Control. Then we started to now try to align the legislation with the Framework Convention on Tobacco Control. By the way, in 2004, what we also did, we raised the age at which people can buy tobacco from 16 to 18. Initially, it was 16 to 18. But then the good thing is that whilst the government said there could be some smoking rooms and all that, the government then sent out a directive to say that there will be no smoking in all government buildings. And then our airline, Air Botswana, also banned smoking in all its airlines. So there was no smoking at all in our airlines and in the government offices. And then, of course, Now, Article 5.3 became, and the guidelines came out as we progressed with the FCTC. And then we started then to advocate for a law that incorporates the provisions of Article 5.3 into our tobacco control law. And so the old act was then repealed. Now we have a new act called the Tobacco Control Act, which now totally prohibits any forms of interaction with the tobacco industry. Interestingly, in that law, even though when we were developing this law, when the government was developing this law, we're not thinking too much about electronic cigarettes. Remember that everybody doesn't want to talk a lot about. At some point, we did not want to talk about electronic cigarettes. It's complicated, it's what. But then the law then defines electronic cigarettes as a tobacco product. What we need to add on is the other little bits, the vapes and others. So there is some kind of progress. And so it was a pleasure yesterday actually to share a floor with you when I was sharing on in terms of the pressure that the government had on in coming up with that law. It was not easy at all. We were targeted by the tobacco. I remember at some point my family was like, do you want to continue with this? The tobacco industry is going to kill you. I'm like, no. They will only kill you if you take their money. and then you change along the way. So I'm not interested in the tobacco industry and all that. So we started lobbying in vigorously after the I founded an anti-tobacco network, the association. Then in 2011, then we started lobbying the government to take the law out of the shelves so that they can then start on it. From 2011, the law was only adopted in Parliament or enacted in 2021. You can't change the law if the government is not committed to do it. Secondly, this did not just come. There was a lot of training that went on. First, train the media. First, to understand and be able to identify that which is called tobacco industry interference. If they understand it, they're going to stay ahead of you. Because then what happened was that all the exposing the tobacco industry came as a result of the media first finding it and coming to us to say, isn't this tobacco industry interference? So when Japan Tobacco, for example, collaborated with the government to say that they are going to help the government with food security issues, imagine a tobacco industry claiming to know a lot about food security issues. When Japan Tobacco came up with that and they had an MOU with the government, it was the media that came to us is like, we've heard that the government is going to sign an MOU with the government. And then we went up to the government to say, is it true? And then the government is like, yeah, it's true, but we're not going to be growing tobacco, we're not going to be what? Because that's their narrative. They are only going to help us. And then, of course, then we started a campaign about the tobacco industry. Way back, we had vigorous campaigns where we felt the tobacco industry was targeting children. So there was one big campaign that we called the I Don't Want to Be a Walking Billboard for the Tobacco Industry, because they were now putting their logos on children's school bags. Can you imagine? So we have the candies and all that look like a cigarette back home. All those are banned by the new law. And our law now prohibits also the sale of anyone who is 21 years, below the age of 21. You cannot sell or buy tobacco. So we've been upgrading and all that, and it totally bans the law. And that was also the multi-sectoral nature that we had we were not just training media, it was civil society, it was also law enforcement officers, it was also targeting some of the policymakers. We went to the chiefs, like in the villages you've got chiefs, we went to the chiefs, we went to the parliamentarians. When parliament session was on, from time to time we requested a slot to sit outside and talk to each parliamentarian, to tell them, to show them the toll that is caused by the tobacco industry and its products. And then we got a lot of support from there. Whatever is happening in one part of the world is also happening in our countries, because we've got one tobacco industry. Whether it's Japan Tobacco, whether it's Philip Morris, whether it's British American Tobacco, they are all the same. They play the same game. So we've got one problem to solve, being the tobacco industry.
So one more question. A theme for me in this conference has been people talking about the sort of colonial power nature of tobacco. We see it in Scotland and Glasgow, we see it in New Zealand and Australia. Anything you want to say about that?
Yeah, well, it's global, like I say. It's global. I mean, for us, we were a British protectorate. So all that you see that is happening here, it's worse in a developing country. Because now what you see is that actually the tobacco industry is actually moving from the developed world to the developing nations. And because they want to also take advantage of the poverty, they want to take advantage, like I was sad, 3 weeks back I was training in Swaziland, Eswatini, and we were training on tobacco industry interference. Guess what? We actually got to know that Philip Morris is funding housing for the poor in Swaziland. And Philip Morris is actually being praised by the government for the good job that they are doing, for the support. And Philip Morris is very smart, and all the other tobacco industry companies, they target the leadership of the country. So they were working with the Prime Minister in Eswatini, and it's all over in the newspapers. So that which is here in the developed world, it's worse in the developing countries, unfortunately.
Well, you have our admiration and our thanks for making time to speak with us today, Bontle. Very much appreciated.
I appreciate it. Thank you also for inviting me to share our insights. Thank you.